Of the 47 million people who don't have health insurance, and actually I'm going to talk in more detail about that estimate in a later episode, a number of them don't have insurance because of health reasons. These are some pretty hard luck cases. They were people who got AIDS or got leukemia, and the treatments and the medical bills just never stopped. Some of them probably started off in the group market with a good job and good coverage, but then lost that. They either maxed out on coverage or they're sick, and they probably sometimes can't work enough to retain eligibility for the coverage. Some of these people didn't have insurance to begin with because they were unemployed or self-employed, and if you get sick with some kind of disease like bone cancer, you're not going to get insurance afterwards. These are the people, of all the people who don't have insurance, these are the people I'm probably the most sympathetic with. Yes, there are lifestyle issues associated with diseases like cancer, but come on, you know, there are people who have cancer who haven't eaten a fried pickle in their whole life. The question is, how do we help these people without breaking the bank, which is usually what happens when government gets involved with healthcare. One option out there is called a state high-risk pool. About 35 states have these, and how they operate is the high-cost individual gets rejected from the private insurance market. And after that, you go to your high-risk pool, and you have to be a state resident, and you generally have to pay higher insurance premiums than anyone else, about 125 to 200% higher, which for someone with high medical bills, I think is fair. My issue is that these people are very sick, and I just think they have better things to do than sit there and fill out forms for their private insurance and then get rejected from that, and then fill out forms for the government high-risk pool. I think we can streamline this. In episode 7, I talked about insurance exchanges. And the beauty of an insurance exchange is that it treats a person in the individual market much like a person in the group market is treated. The risk is spread. Now, I think you'd have to force the issue. I think you would have to require insurance companies to take all comers. The days of underwriting, the days of cherry picking only the healthiest of candidates, that's over. But with the spreading of the risk in a large group with lots of healthy people would help to address that cost issue. And if that didn't do the whole thing, we could still work on a behind-the-scenes mechanism like an assessment on policies or like an assessment on insurance providers to help smooth out the high-cost bumps. I mean, look, we're going to pay for this one way or the other. Either these people are going to drag themselves to the emergency room and we're going to pay for it there, or they're going to become destitute and eligible for Medicare and we're going to pay for it through that. So let's just get it over with.